There's an increased cases of cancers globally. 80% of the world's population is vitamin D deficient. Is vitamin D deficiency leading to cancer formation? Now, do you guys know that during time, the people that died were people that had vitamin D deficiencies? Do you guys remember that? But if it's isolated and given to you in a bottle form, it's as expensive as $10,000 per bottle. If I was to take 100 cancer patients, about 90 of them would have vitamin D deficiency. Now, we do know that there's an increased cases of cancers globally, but also about 80% of the world's population is vitamin D deficient. Is there a link between vitamin D deficiency and cancer progression, or is vitamin D deficiency leading to cancer formation in the first place? Now, let me break it down to you. Vitamin D is a hormone that has been shown to be really important for the cells, the immune cells that have a role to play in cancer killing. Now, these cells are what we call CD4 T cells and your natural killer cells. Now, for these cells to be activated to recognize cancer cells forming in your body, they need what we call interleukin 15. Now, interleukin 15, literature has shown that one of its stimulators that stimulates their formation or their release in the human body is vitamin D. And so if your vitamin D levels are low, you cannot produce interleukin 15, which your natural killer cells and your CD4 T cells, which are immune cells that can actually fight these cancers and kill them, will not be able to be activated. Now, do you guys know that during COVID time, the people that died or had complications with long COVID were people that had vitamin D deficiencies? Do you guys remember that? That is because your natural killer cells and your CD4 T cells are the ones that play a role in even viral and bacterial killing. Now, think about this. There are immunotherapies that are used for cancer treatment. That is basically interleukin 15 in its purified form that is given to the patient, and then of course the patient's immune cells will be activated that will now start attacking these cancerous cells within the body. And it does not matter what type of cancer. The moment your CD4 T cells are activated and your natural killer cells are activated, they can go around your body and investigate to find out wherever the cancer is, and then they start attacking them. It is like giving ammunition to the the immune cells to go and attack any cancer cells, and they can recognize them much quicker and much easily when you give them the interleukin 15. And so today I urge you to supplement on your vitamin D. And the reason why we call it vitamin, I don't even know, because it is not a vitamin, it is a hormone. It has a cholesterol backbone, just like your progesterone, just like your testosterone. So why do we even call it vitamin? Why are we dampening its importance so much? Now, vitamin D, the most expensive one may be even 50 pounds. However, with that, you can stimulate your interleukin 15. But if interleukin 15 is isolated and given to you in a bottle form, I think it's as expensive as $10,000 per bottle. And so with this information, I hope that you're going to take heed and supplement on your vitamin D, get your levels to be optimized, optimum level, and so you decrease your chances of all type of cancers formation or tumors formation in your body in the first place. This is the link between vitamin D deficiency and fibroids. And if you're a Black woman who is constantly vitamin D deficient, please take heed to this information because you might actually develop fibroids. Now, there's literature to show that Black women are more susceptible to fibroids formation. Now, a lot of people do not know that fibroids are tumors. What leads to tumors formation in the first place? Vitamin D deficiency has been strongly linked to tumor progression. That is because when your vitamin D levels are low, your hormonal levels are also dysregulated, which leads to hormonal imbalance. Now, in another video, I will talk about how vitamin D levels decreasing impact your hormonal imbalance. However, today I will tell you that hormonal imbalance would lead to fibroid formation. This is because when we take fibroids out of the womb, then we do some biochemical analysis, we see that they have estrogen receptors very highly expressed in them. And apart from that, insulin receptors also highly expressed in them. This is because vitamin D deficiency will lead to insulin resistance. Now, insulin resistance will also lead to your fat metabolism impairment, and that impairment will lead to more estrogen formation. Now, the more estrogen formation, it means that estrogen will stimulate the fibroid or the tumor formation that is actually happening, or it will lead it to grow at a faster pace. Maybe the hormonal imbalance may not lead to the tumor or the fibroid formation in the first place, but it will definitely lead to its progression at a faster rate. And so if you have fibroids, whether pedunculated, whether subserosal, whether submucosal, whether intramural, it is very important that you supplement on high dose vitamin D. Like the minimum should be 10,000 international units per day. But apart from that, make sure that you're taking the K2 with it, which will decrease the side effect of the vitamin D3, because calcium absorption is going to be increased, but then the K2 will drive them away from your blood streams into your bones and into your teeth. Now, fibroid formation is linked to vitamin D. So I beg you, even if your mother has fibroids, it doesn't necessarily mean that you're going to have fibroids. It just means that if you do not trigger that gene, you are not going to get the fibroid formation in the first place. And vitamin D has been shown to directly go to the nuclei, which is where your DNA is, and it can directly cause gene expression. And if gene expression is suppressed, then you do not have the fibroid formation in the first place. So please make sure you're taking your vitamin D. In this video, I'll tell you how Black people are more susceptible to cardiovascular conditions when they live in the Western countries because of vitamin D deficiency. Now, when we talk about cardiovascular issues within the Black community, one of them that is devastating is high blood pressure. Now, when a person has high blood pressure, the reason why your doctors tried their best to bring the numbers down is because without doing so, you are at risk of end-stage organ failures. Now, apart from that, you may be also at risk of strokes, at risk of cardiac arrest, and at risk of anginas, hypertrophy, and the list continues. Now, how is vitamin D deficiency linked to hypertension, which will then, if not treated, lead to more serious conditions? The reason is that high blood pressure is strictly linked to low vitamin D due to this. Vitamin D levels regulate calcium absorption and calcium metabolism. And so when your vitamin D levels are low, your calcium levels are also gonna go low. Now, because your body needs calcium absolutely for its physiological functions, it cannot afford to allow calcium to go low. And so when calcium levels are going low with the vitamin D, what essentially is gonna happen is that your PTH, which is sort of like for defense mechanisms, your PTH levels are going to go up, which are your parathyroid hormones. And what they do is they will go into your bones, take the calcium from your bones and dampen them in your bloodstream. Now, because they are not the major regulator for calcium metabolism or calcium absorption, they are not going to maintain the levels really well. And so that would lead to your calcium receptors binding to a lot of the calcium that are roaming in your bloodstream because your PTH has dampened them in your bloodstream. Now, guess what? Their heart muscles are going to receive the calcium and they will contract really hardly. Now, this increased contractility would also induce your heart to pump a lot harder across your blood, across your vasculatures. And we all know that blood pressure is measured by the pressure with which your blood is hitting the blood vessel walls. And so this will then, of course, be translated into higher numbers in your systolic and your diastolic. Now, If you were to supplement with vitamin D3, K2, the D3 would cause the calcium to be absorbed, and then the K2 will drive them away from your bloodstreams, making the blood vessels relaxed. Now, guess what? When the blood vessels relax, then also the calcium levels leave your bloodstream and go to your bones. Your heart's calcium channels will not be stimulated for it to beat a lot harder, so that then it exerts the force on your blood vessel walls, and so your blood pressure levels will come down. Now, apart from that, even the endothelial cells, your smooth muscles that is lining your blood vessels, when there is no vitamin D levels there, guess what? The calcium will also stimulate your smooth muscles and they will contract. And so if the blood vessels are constricted, then your heart has to pump a lot harder. Apart from the fact that your heart is already pumping harder because calcium levels are high, your blood vessels are also narrowed down, and so that is also very difficult to pump blood across. Now let's move to the kidneys. When your blood vitamin D levels are low, your kidneys will not be able to, your vitamin D levels actually block what we call renin. Now, renin is what is converted into angiotensin 1 and then angiotensin 2. And then angiotensin basically is what constricts your blood vessels, and then it makes your blood pressure goes up. But when you have adequate levels of vitamin D in your bloodstream, it blocks this renin protein, and then the renin protein obviously cannot be converted into angiotensin, and so that your blood vessels are relaxed and your blood pressure comes down. So you see how vitamin D actually plays a huge role in all these processes that regulate your blood pressure. Apart from that, if you have low levels of vitamin D, guess what is going to happen? You're going to have frequent urination, because like I said earlier on, vitamin D levels low means your calcium levels are going to go up. And if calcium levels are up, guess what? Your smooth muscles are going to be constricted. And so inside your bladder, your smooth muscles are contracted. So even if a little urine gets to your bladder, because your smooth muscles are constricted, it is going to be pushing that urine out, and so you have to go for frequent urination. And that is how vitamin D actually increases your blood pressure. There are more pathways where your vitamin D deficiency can lead to blood pressure, but for today I'm giving you these 3 pathways. So your calcium levels being high will lead to your heart pumping a lot harder, and then your blood vessels constricted, and then the fact that vitamin D actually inhibits renin, which will then make sure that angiotensin is not synthesized, or it is not converted, and then your blood pressure comes down.